Hey everybody, welcome to a presentation on trauma. When we're talking about development, we also have to talk about things that interrupt, quote unquote, normal development. I don't totally love that term, normal development. I know when we're talking about statistics, we talk about the normal curve and what falls within that range. But there's always differences in development, and comparing kids to each other or to certain standards isn't always beneficial for our clients. So I want you to kind of keep that in mind. But we're going to focus on trauma because that is one thing that can interrupt normal development. So I'll tell you a little bit about me. This presentation initially was developed for classroom teachers to kind of give them an insight into what might be going on with students. And so I've kind of raised it up a little bit for counseling for you guys, but it's kind of the same basis because we're building empathy about our clients and about people and kind of seeing where the stalling in their development might be. So there's a little bit about me. I was an elementary teacher for 5 years, school counselor for 7 years. I'm currently a play therapist for a school district. Best job ever, love it. And I also teach, as you guys know, adjunct professor for TMUC. I usually teach one of the experiential classes like either practicum or internship or advanced or basic skills, and then occasionally this development class or something online. I have presented about trauma in the brain and social emotional learning at local and state conferences. We're going to start with the brain and brain development. I found that a lot of people, myself included, until I kind of got into this stuff, didn't really exactly know about the brain structures and where emotions and big feelings come from and the physical effects on our brain of trauma. In Mesquite ISD, the district I work for, we teach children from pre-K on up about their brain and talking about, we name the hippocampus where memories are formed. We name, that's that green structure in there. The yellow structure in the middle is the amygdala. We use this exact picture with kiddos, and that's where our feelings live. And we talk about the prefrontal cortex and that being the seat of logic and reasoning. And when we flip our lid is the terminology we use, which comes from Dr. Dan Siegel in his work about the brain. We say when we flip your lid, then your feeling brain is in control and your thinking brain is no longer in control. And when we talk about trauma, then that comes into play, and that makes kiddos are easier to flip their lid because they spend more time in that fight, flight, or freeze. And so understanding some of the physical aspects of the brain and how trauma affects is really important. Some of this work is built on Dr. Dan Siegel's work about the brain and comes from social and emotional learning. If you're familiar with CASEL, they're really big on SEL, and the Momentous Institute here in Dallas coined the phrase settle your glitter as a way to teach kiddos to kind of calm themselves down. We even make glitter jars and talk about how some glitter settles quicker than other glitter depending on the size of the feeling, and kind of use those as analogies. So feel free to take some time and look that stuff up if that's interesting to you. But we're doing that because we found that there wasn't an awareness, and regulation kind of is seated in awareness of knowing what's going on. We think of our feelings as coming from our hearts, but really it comes from our brain, and knowing what happens in our brains and our bodies when we have those big feelings, when we flip our lids, is the first step to being able to help handle our reactions. All right, so back to trauma. What is trauma? So trauma, when our emotional, cognitive, physical, spiritual, and social abilities become impaired following an event that our nervous systems perceive as threatening to ourselves or others. And that perceive is really important because it's not for outside people to judge, it's how that person judges and how their nervous system assimilates whatever it was that happened, that incident. So it affects it in cognitively, like how your ability to process through thoughts and makes good judgments. Trauma affects our emotions. We are looping with emotions of shame, guilt, fear, anger, pain. Physically, it affects muscles, joints, digestion, metabolism, temperature, sleep, our immune system. Spiritually, trauma can affect our worldview, the lenses which we see reality, typically so that someone who's experienced trauma sees it as unsafe. Their worldview is that the world is unsafe. It can affect our meaning understanding and meaning of life. It affects society and the world when we're talking about large events. Socially, it affects our relationships with spouses, family, friends, colleagues, strangers. And because it affects so many so deeply, it can even affect the structures of society. Trauma is personal. It's phenomenological. It defies judgment. We cannot say to our clients, oh, well, that wasn't traumatic. That doesn't meet the criteria. There's no specific criteria or list saying that something is or isn't. You know, there are things that are widely accepted as traumatic. And we'll talk about the ACE study here in a little bit and later in the semester too. But there's no way, and that comes back to that core condition, being non-judgmental with our client. Trauma can be a one-time event or a series of prolonged events. It can even be collective trauma. It doesn't have to be something that someone has personally experienced. It can be something that affects a community or a country. And I know we've had mass shootings been in the news, and some of those can be collectively traumatizing. I personally don't watch the news. I deal with a lot of heavy stuff in my job day to day, and I for my own mental well-being, I cannot take in more information about trauma and crime and stay a functioning, healthy person. This graphic comes from the ACEs, Adverse Childhood Experiences Study. And there's going to be a whole big thing later on in the semester. There's an assignment over it and a video where you watch Dr. Nadine Burke Harris, and she's such a great speaker. Wish I was a great orator like her. And she's going to delve into the background and how ACEs got started and some of that. So we're just going to touch on it a little bit here. These things are what are widely accepted as trauma. And that would be physical, emotional, sexual abuse, neglect, whether that's physical or emotional, things that would be considered household dysfunction, growing up with a parent with mental illness, a relative incarcerated. This says mother treated violently, but it could be father treated violently. Growing up with a family member who is substance abusing, or a family of divorce. Now, when you kind of think about these things, the study kind of gives some history and some outcomes about it, and there'll be more on that. But 36% of people have 0 when the study was done. 26% have 1 of these ACE. 16% have 2. 9.5% have 3, and 4 or more ACEs. They don't even break it down further than that. 4 or more is 12.5% of people. And when you kind of put some of those numbers together, 64% of people in the study had 1 or more ACEs. And that's pretty staggering. So think about how this would affect your clients, knowing that they might come in with probably more than likely 1 or more of these things, and how you might incorporate that into your practice. This comes from the Adverse Childhood Experience Study, and so this is kind of that how those adverse childhood experiences, how trauma influence health and well-being, not just mental health, but our overall health. So there's that historical trauma, social conditions, local context. Then you've got on top of that layer, those are some of the societal kind of constructs. And you've got adverse childhood experiences, be abuse and trauma. That disrupts neurodevelopment, that disrupts the structures of the brains. It can then impair social, emotional, cognitive functioning. Then when those things are impaired, people often adopt risky health behaviors, and that can lead to disease, disability, social problems, and even an early death. So this was put in here when I did this with teachers, and I kind of think it pairs well with counseling. And teaching, we talk about you can't do the Bloom stuff, like teaching kids the different levels of learning, until you take care of the Maslow stuff. So you guys are probably familiar with Maslow's hierarchy of needs, and the same thing goes back to counseling and client readiness. Our clients may not be ready for the changes made in counseling if their basic needs are not met, and if they're experiencing this trauma might need to be dealt with first. This is Maslow's hierarchy of needs, which you're probably familiar with. Our clients can't move up the hierarchy of needs until those lower needs are met. So this kind of goes back to the brain and like what's going on with our client's brain after they've experienced trauma, whether that's ongoing or a one-time past event. It's the difference between, you know, a brain that's developed without trauma. If I just apply myself, I can do this. If I just do this in life, if I just listen, you know, even if I struggle or I fail a couple of times, I'll get through this. But a trauma brain is a survival brain. It's a brain that's living more in that fight, flight, or freeze area. And the more time you spend into your survival brain, the more time you spend with fight, flight, or freeze, the harder it is to get into that learning brain. So it's the difference between if I just apply myself, I can get this done, versus afraid of getting things wrong. It's hard to get into that prefrontal cortex. And so it often with our clients can look like, you know, you've heard that saying, fake it till you make it. And sometimes it's a decent strategy of trying things out and trying on behaviors until you get it. But it also can be like people who look like they're trying to cope and get by, but under the surface, they're really not. And this is kind of a, you know, like a warning that trauma can look a lot like other diagnoses. Trauma can look a lot like ADHD. Trauma can maybe even, especially in the case of the boy who was raised as a dog, might meet some of the criteria for other diagnoses like autism. So be aware of clients that simply meet the criteria on the DSM. You know, yes, they may check off, you know, 7 out of 12 boxes on an ADHD screener, but it doesn't necessarily mean that it is ADHD. And it's worth having a conversation about background and about possible trauma or adverse childhood experiences to see what really may be lying under the surface, because we don't want to diagnose people with these diagnoses that stick with kids or people for a long time when really there's trauma and that needs to be treated. Some of this information comes from Understanding Trauma, Learning Brain versus Survival Brain. All the links will be at the end of the presentation if you're interested in any of this kind of stuff. This is one of my favorite things. I use this one as a school counselor with teaching kids. We'd go in and talk about their brain, and I would use the analogy of, you know, your amygdala is like your dog in a doghouse. And when it's safe and happy, it's safe in its doghouse, it's feeling great. When a dog is scared and comes out of its doghouse or has big feelings, it might fight, flight, or freeze. So a dog might bark, it might run away, it might freeze up and not know what to do. That's what this graphic is. Your brain doesn't stop and think like when it's presented with danger, what your brain perceives as danger. It doesn't stop and think when it sees a bear. What kind of bear is this? Is it friendly? Your downstairs brain takes over and gets you out of there. What happens when the bear lives at home? Your brain becomes hypervigilant. The ability to distinguish between small problems and major threats diminishes. And this is where we see people, kids and adults, that have a reaction that's not in proportion to the stimulus, to the antecedent, whatever is going on, the incident. This comes from Why Do We Lose Control of Our Emotions? And I really like it. It's great with kids. All right, so let's look at how trauma affects cognitive performance, because we know how trauma is going to affect feelings. But let's talk about cognitive performance. And as we're talking about this, I want you to think about the implications for the counseling process. So if trauma affects things like our client's ability to comprehend and use expressive verbal and nonverbal language, like what that means about the counseling process. When it affects memory, especially the sequence and processing and assimilating memory, understanding cause and effect, affects the sense of self and the ability to take perspectives of others, the ability to identify emotions, using language to relate to people. It affects empathy. It can affect the goal-setting process, the whole process of identifying, you know, this is the end I want. I need to do X, Y, and Z to get there. It affects that whole process. It can affect transitions, going from one thing to the next. If you notice somebody who's always scanning, watching, they're hypervigilant. trauma damages our internal filter and that ability to say this is safe, this isn't safe. And often trauma brains think everything's unsafe. It affects focus. It's often misdiagnosed as ADHD, those kiddos who are hypervigilant. It affects our ability to be engaged in learning. Students who have experienced trauma are not developing an internal framework. And so if you think about clients, this says students, but if you think about our clients and they're not able to develop an internal framework, and we're working with them, and maybe we're setting goals, and maybe we're processing and talking about things, but if the things we're processing they're not able to develop like an internal framework for, then how are the things that we're doing, how is that counseling process being helpful? Is it being effective? And so that's why it's really important to assess for trauma. They're not learning skills to get by and cope, and that's where we come in. We're going to talk about how we help. So kind of the external, internal stuff, like what does this look like? You know, when we think about somebody who's experienced trauma, you might think about that outburst, that flipping your lid, aggression, defiance, hyperactivity, reactivity, impulsiveness, somebody who might have a bigger reaction in proportion to the incident, you know, flinching out loud noises would be something. And then there's also internal processes, being withdrawn. I use the word emo here because this is what a lot of educators talking to educators of like high school students kind of called kiddos who are withdrawn or seem to fit a certain type. It can even look like perfectionism. And I put this in red, beware of the invisible person, because it's a lot easier to identify and work with externalizing behavior than it is with the internalizing behavior. And I'm just as scared, maybe even more scared of internalized issues, because it's not as easy to identify and see what's going on with our clients. And so that's where we come in, and having things in place and being able to gently confront and ask those things and be with our clients in those tough moments when they're talking about these things can really be helpful. This comes from the ACE study, and so this kind of goes, I like this graphic showing what the possible outcomes of adverse childhood experiences. Early adversity has lasting impacts, and we know that just because there's trauma that happens early on, there's this myth that like, oh, if it happens to a baby, something bad under 1 or 2, they're not going to remember it, so how can it really affect them? But we know that the body keeps the score. In fact, there's a great book called The Body Keeps the Score. And we know that it affects them, even if they can't call to mind that specific memory and say it's this or that. We know that those early, through attachment and that stuff, that early period of life is so very important. So adverse childhood experiences can lead to more physical injury, traumatic brain injury, fractures, burns. It can lead to mental health problems, depression, anxiety, suicide, PTSD. Those things are all increased. It can lead to maternal health issues, unintended pregnancy complications, fetal death, infectious diseases, chronic diseases, cancer, diabetes, risky behavior, alcohol and drug abuse, unsafe sex. And then it can have impacts, ACE can have impacts in opportunities later in life, the education, the occupation, the outcome, the income later in life. So here's the bad news. And you mean that what I've shared so far isn't bad enough? The bad news is we can't stop trauma. It's going to happen. I have a 3.5-year-old daughter, and we were in a traumatic incident over the summer where we were outside the Earl Cabell building in downtown Dallas, actually paying for a parking spot right next to the building, when a man decided to bring a firearm and start shooting at the building. We had to run and hide in my car. And as much as I wish that had never happened to my child, the fact of the matter is there's lots of traumatic incidents, and we cannot stop those things from happening, and it does change the brain. But I'm going to tell you the good news in just a second. But I'm going to bring up my personal story because I did notice some of these things after this, like some of these outcomes, like, oh, I just had a traumatic experience, and then doing some research and learning more and getting ready for this presentation about ACEs for educators, that I realized that, some of these things applied to me, like, oh, was I having more risk-taking behavior? Was I having some cognitive and emotional impairment? And it was really important to me to get some counseling to help to make sure, especially in the line of work that I do, doing counseling and therapy, that it didn't affect me or my kiddo. I can mediate those effects. Trauma changes the brain. So it's kind of like taking bleach and dumping bleach on the brain. It kills brain cells, it changes structures, it shrinks. When you think about what bleach does with clothing, it leaches all the color out of it, and that's kind of what trauma does to our brain. It washes out all of the other things so that what's left, we're left with those big emotions, we're left with our amygdala in control, we're left with that fight, flight, or freeze, and we're not left with a lot of those other cognitive processes. Here's the good news. We can help heal trauma. That's probably one of the reasons you got into this gig. Positive changes can be made in the brain. Yes, trauma affects the brain structures, but positive changes can also be made too. Here's some ways that came out from that adverse childhood experience study, some ways they say that can help to combat trauma. Obviously, we're never going to stop it, so when it happens, we need to know what we do to help. Some of these things are societal. Strengthening economic supports to families, strengthening their financial security, family-friendly work policies, like when families are also worried about losing their job or making ends meet. Sometimes people don't take the steps they need to take care of mental health because those physical needs often come first. We need to make mental health just as important as physical health. Change social norms to support parents and positive parenting, public engagement, enhancement campaigns, legislative approaches to reduce corporal punishment. I know that can be a hot button issue. Provide quality care and education early in life. So this says preschool enrichment and family engagement, and I would say play-based preschool, because there have been studies that show that even though, yes, academic-based preschool programs, initially those kiddos do better, but after time, kiddos who are in a play-based preschool or even no preschool at all surpass those who are in an academic intensive. So the importance of play, and as a play therapist, of course, I love that. Enhance parenting skills to promote healthy child development. Early child home visitation, parenting skills, family relationship approaches. If you're working with kiddos, it's important also to work with the families and the parents. I see kiddos for play therapy, but I'm also working with the parents too about what's going on and the ways they can support their kiddos. Intervene to lessen harm and prevent future risk. We're enhancing primary care, talking about physical health. We need physicians to also recognize the signs and to help mental health, the connection between physical and mental health, be strengthened. Behavioral parent training programs, play-based parent training programs, treatment to lessen the harms of abuse and negligent exposure, treatment to prevent problems, behavior, and later involvement in violence. That's where we come in as future counselors. That's where you come in. I love Brené Brown, and I stole this quote from the internet, so I hope Oprah doesn't come and get me. But I love this quote. For me, it embodies a lot of what we do. It comes down to connection. The energy that exists between people when they feel seen, heard, and valued, when they can give and receive without judgment, and when they derive sustenance and strength from the relationship. And that's what you give your clients as a counselor. Whether you're going to be a school counselor or a mental health counselor, you stand in the gap and you make sure your clients feel seen and heard and valued, and that you are there with your core conditions of empathy and non-judgmental, unconditional positive regard. Those are the foundations of counseling. Yeah, you're going to lay your theory on top of that. More for that later in your clinical classes. But that is the foundation. That connection is where the healing is. So I kind of want to leave you with that. The last slide of this is the references. If you're interested in any SEL stuff, a piece of my job is to support SEL, social emotional learning, for the district I'm in. And so I've got lots of cool ways to teach it with kids, lots of things that are concrete ways to use things with kids, from puppets to coloring stuff. If you're interested in that, I don't mind. Shoot me an email and I'd be happy to share anything with you. Thank you.